Now we'll discuss the assessment of the adrenal gland. And in assessing the adrenal cortex, each of the main cortical hormones can be measured. So aldosterone and androgens are primarily measured when excess secretion of either one is suspected. Conn's syndrome is one example of an excess aldosterone state where a benign adenoma of the adrenal gland makes too much aldosterone. Congenital adrenal hyperplasia is a condition in which adrenal androgens are overproduced, just to give one example. Cortisol, on the other hand, is measured when states of cortisol excess, generically known as Cushing's syndrome, are suspected, and also when states of cortisol deficiency are suspected. And one example of this would be primary adrenal insufficiency, or Addison's disease, where the adrenal glands fail. For the adrenal medulla, the catecholamines themselves can be measured, or the breakdown products known as metanephrines can be measured. And these can be measured either in the plasma or in a 24-hour urine sample, again, to get an idea of the cumulative secretion over a longer period. Clinically, these tests are most often ordered when states of excess catecholamine secretion is suspected. For example, an adrenal tumor that makes excess catecholamine, or a paraganglioma, which is a tumor of the sympathetic nervous system, is producing excess catecholamines. Now let's look at the factors affecting measurement of the adrenal hormones, starting with aldosterone. And remember that aldosterone is regulated by the renin-angiotensin system. And so anything that normally increases renin is going to increase aldosterone, and vice versa. So ingesting a very low sodium diet or being volume depleted because of diuretics or just simple dehydration, or standing upright for a long time before a blood draw or a urine measurement are all things that might increase aldosterone measurements in a normal individual and give a false diagnosis of aldosterone excess. On the other hand, ingesting a very high sodium diet or being volume overloaded before measurement of aldosterone, or simply lying supine for a long period of time, should, in a typical individual, decrease aldosterone secretion. And cortisol measurement is affected by a very different set of factors compared to aldosterone measurement, and two of those factors are listed here. The first is cortisol binding globulin, and cortisol is 90% bound to cortisol binding globulin, or CBG, in the bloodstream, and approximately 6% is bound to albumin. So factors that increase your CBG will increase your total measurement of cortisol, even if there's no excess cortisol. And factors that decrease CBG will decrease the total measured cortisol, again, even if the patient is completely normal. Some factors that increase and decrease cortisol binding globulin are also listed here. So any exogenous source of estrogen, particularly oral estrogen like birth control pills, can rise cortisol binding globulin, as can pregnancy or other excess estrogen states. And CBG will be lowered by severe end-stage liver dysfunction. But neither of these binding globulin dysfunctions or disturbances would affect the total urinary or salivary free cortisol measurements. The second factor affecting cortisol measurement is the time of day. Cortisol is secreted in a circadian pattern, so it should be highest in the morning, just before waking, generally around 6 or 6:30 in the morning for a normal sleep pattern. And the measurement should be lowest in the evening, just before going to sleep. And so individuals with an abnormal or disturbed circadian pattern may be expected to have abnormal or variable cortisol measurements. Catecholamines, as you might expect, are affected by sympathetic neural stimuli, and factors that increase stimuli will also increase catecholamine secretion. So stress and excitement and anxiety, several drugs listed here to name a few, and withdrawal states, including withdrawal from a blood pressure drug named clonidine, or even withdrawal from alcohol use, will increase catecholamine secretion. So when testing for states of excess catecholamine secretion, the patient should be tested under calm and controlled conditions with discontinuation of interfering medications when feasible so as not to get a false diagnosis. These days, measurements of fractionated catecholamines and metabolites using liquid chromatography and tandem mass spectrometry has decreased analytical interference from drugs and diet, but it's still something to keep in mind. Now let's circle back to that original overview of the hormones produced in the adrenal cortex and adrenal medulla. And so here we've added states of excess or deficiency associated with each hormone, and you'll hear much more about these states in the sessions to come that outline clinical syndromes associated with the adrenal glands.